Wisdom teeth. You wake up from surgery with a mouthful of gauze and chipmunk cheeks. 4 teeth gone, tossed in a bin somewhere. Nobody mentioned that what just got thrown away could have been frozen and used as medical raw material for the rest of your life. Third molars, or wisdom teeth as we all know it, are quietly becoming one of dentistry's most useful raw materials. If you lose a molar later in life, a wisdom tooth can actually be transplanted straight into that empty socket and work as a full replacement, roots and all. Your mouth came with a spare, and nobody told you. Inside, each tooth is a soft pulp core packed with stem cells, early-stage cells that researchers are actively exploring for all kinds of treatments. Some clinics will now freeze that pulp the moment a tooth gets pulled, banking those cells the same way people bank cord blood at birth. Not every wisdom tooth even needs removing. If they grow in straight and cause no problems, dentists now say just leave them. They'll do their job quietly for decades. A spare tooth, a stem cell bank, and a lifelong backup plan, all growing for free in the back of your mouth, completely unannounced. Goosebumps. You hear a song that hits too perfectly, or step outside into freezing air and your skin erupts in tiny bumps that do nothing. You might think getting goosebumps is a leftover reflex from ancestors with thicker coats, but the tiny muscles at work are actually more useful than you think. The muscles are called erector pili, and they're wrapped around the base of every hair follicle, helping maintain its structure and keep the whole unit functioning normally. Right next to the erector pili are clusters of stem cells, and recent research found that these muscles help maintain the environment those stem cells need to keep hair growth cycling properly. Your goosebump muscles are doing quiet maintenance work on your skin every single day, completely beneath your notice. And that's before you get to what doctors use them for. Goosebumps show up so reliably during opioid withdrawal that they're written into the formal medical scoring tools used to track a patient's condition in real time. Apparently, your skin is a more reliable witness than most people. Your body's most dramatic, pointless-looking reflex turns out to be one of its more honest ones. It's practically impossible to fake, which is more than we can say for most people on a first date. Appendix. You're rushed to the ER in pain, and a surgeon tells you your appendix needs to come out immediately. The scary part isn't the surgery, it's finding out afterward that nobody actually knows what it does. They just take it out and hope for the best. Turns out it has at least 3 jobs, and nobody told you because your poor appendix is already in the trash. After a brutal stomach bug wipes your gut bacteria completely clean, your appendix acts as a safe house. While everything else gets flushed out, it sits tucked in a sheltered corner of your intestine, protecting a small colony of good bacteria like a doomsday bunker. Once the storm passes, those bacteria crawl back out and restock the whole system. That sheltered corner isn't an accident either. The appendix is lined with immune tissue that spends your childhood sampling every bacterium that passes through, logging what's normal and what isn't, so your immune system knows what to attack and what to leave alone. And then there's what excites surgeons the most. It makes excellent spare plumbing. It gets routinely repurposed as a channel connecting the bladder to the skin, giving patients with certain bladder conditions a way to drain it themselves. Your appendix has 3 jobs, and that's way more than most of us have. Tonsils. You're 7, and your throat feels like you swallowed a cactus. That's the first time you've heard of tonsils, and the last time you've had them after a surgical removal. Turns out the tonsils nobody cares about were actually running security, and pulling them out early might have consequences that take years to show up. Your tonsils sit right at the back of your throat, which is the exact point where everything you breathe and swallow enters your body. That location isn't random. They're packed with immune cells that sample incoming bacteria and viruses, building your body's threat database during the years when your immune system is still figuring out what the world looks like. They're the first checkpoint in a system designed to recognize danger before it goes any deeper. A large study tracking kids over many years found that those who had their tonsils removed early faced higher rates of breathing problems and allergies later in life. Not enough to stop the surgeries entirely, but enough to shift the guidance from take them out, no big deal, to leave them in if you can. The bodyguard you fired in 2nd grade might have been doing more of the work than anyone realized. Body hair. You've shaved, waxed, lasered, and plucked it, and it just keeps coming back. At some point, the whole thing starts feeling less like a feature and more like a punishment. But that stubborn regrowth is actually your body defending your otherwise exposed skin. Each hair sits inside a follicle packed with nerve endings. Together they pick up the faintest touch, the lightest air movement, and anything getting too close to your skin, which is a very sophisticated way of saying, your arm hair exists to tell you a mosquito is about to ruin your evening. Some hairs have more specific jobs. Eyebrows redirect sweat away from your eyes. Eyelashes catch debris before it hits the surface. Nose and ear hairs filter out dust and particles before they get any further. Hair follicles are also one of the only structures in the human body that fully regenerate on a cycle throughout your entire life, making them one of biology's most valuable models for understanding how human tissue repairs itself. Which means the thing you've spent years fighting is helping scientists crack medicine's hardest problem. The war on body hair has been going on for centuries, and your body has never once considered surrendering. Male nipples. Male nipples are probably the most mocked, useless body part on the internet, with entire Reddit threads dedicated to questioning why they exist at all. They don't do anything obviously visible, and they most definitely don't feed anyone. But it turns out they can be essential in a few unexpected ways. Men can develop breast cancer. Around 2,800 cases are diagnosed in the U.S. every year, and having visible, monitorable tissue means there's actually something to catch early. In these unfortunate cases, the nipple that seemed purely decorative functions as an early warning system. A lump, an unexpected discharge, a change in appearance can all be warning signs worth catching. The tissue can also become medically active under certain conditions. Some medications and hormonal imbalances can trigger actual milk production in men. And before you start panic searching on WebMD, it's a rare but real condition. And when it happens, doctors treat it as a meaningful signal pointing toward an underlying condition worth investigating. Not bad for something the internet spent decades making fun of. Spleen. Someone you know has probably had their spleen removed and walked away seemingly fine. It's the organ that disappears without a trace, which makes it very easy to assume it wasn't doing much to begin with. But in reality, the spleen has several jobs. The most important one is protection against certain dangerous bacteria. A healthy spleen filters your entire blood supply and catches encapsulated bacteria, a specific type that the rest of your immune system struggles to handle on its own. Lose your spleen, and doctors immediately put you on prophylactic antibiotics, give you additional vaccines, and treat any fever as a medical emergency. That's the medical equivalent of removing one brick and watching the whole wall become a liability. Beyond that, the spleen runs a quiet quality control operation on your red blood cells, pulling out the old, damaged, or misshapen ones before they cause problems, and recycling their components like iron back into circulation. But just like real-life recycling, no one appreciates this process until something bad happens. On top of that, the spleen also stores a reserve of red blood cells and platelets that get released into the bloodstream during heavy blood loss, essentially functioning as an emergency backup supply. The spleen doesn't announce itself. It just handles things, until it can't. Palmaris Longus. Press your thumb and pinky together and flex your wrist slightly. If a thin tendon pops up in the middle of your forearm, congratulations! You have a palmaris longus, a muscle that does almost nothing, and about 1 in 5 people have no trace of it with 0 consequences. On paper, that makes it evolutionary dead weight, a leftover your body never got around to deleting. But surgeons love it. When reconstructive hand surgery requires a tendon graft, replacement material to repair damaged hands, the palmaris longus checks every box. It's accessible, structurally sound, and redundant enough that removing it causes no measurable loss of strength or function. Your body pre-installed a spare part with no real job and left it exactly where a surgeon's hand can reach it. The tendon itself is a vestige, a leftover from when our ancestors needed stronger grip for climbing, now reduced to a minor supporting role in modern human anatomy. Evolution hasn't fully phased it out yet, which means roughly 80% of people are walking around with a built-in surgical resource they'll probably never need to use. The muscle that does nothing turns out to be worth keeping around, just in case. Thymus. Your thymus is most active when you're a child, then slowly shrinks until it's mostly fat by the time you're middle-aged. Doctors can partially remove it during infant heart surgery, and most children recover fine. It's the organ that seems to politely excuse itself from the room and never come back. What it built before leaving, though, runs your immune system for the rest of your life. The thymus is the only place in your body where T cells, the immune system's most targeted, precise fighters, get made and trained. Every T cell that patrols your bloodstream right now was shaped inside your thymus, taught what counts as a threat and what counts as your own body. That second part matters enormously. Without proper thymic training, T cells can turn on healthy tissue instead, which is one of the core mechanisms behind autoimmune diseases. The thymus doesn't just build an army, it makes sure the army knows who not to attack. The training happens early, and the effects echo for decades. Research on infants who had thymus tissue removed found it can accelerate immune aging. shifting the long-term trajectory of their immune system from a single procedure in the first years of life. Your thymus might have retired early, but everything it built is still running. Ear muscles. If you've been jealous of others who can wiggle their ears, fret not. Even if you don't have this impressive party trick, your ears are still using those muscles constantly, just in a way you can't show off to your crush. Those same muscles could soon power hearing aids that automatically amplify whatever sound you're actually trying to listen to. And you won't even have to toggle buttons or use confusing apps, just an automatic device following your attention in real time. When you focus on a sound to your left, the tiny muscles around that ear fire slightly, even if nothing visibly moves. Your brain is still sending the turn toward it signal, the same one that lets a dog swivel its ears across a room. The hardware got downgraded somewhere in human evolution, but the signal never switched off. Researchers found they can read those signals, detecting exactly which direction a person is trying to listen to just by measuring the electrical activity in these muscles. Turns out, your ears have been quietly broadcasting your attention this whole time. Nobody thought to tune in until now. Subclavius. The subclavius is a small muscle tucked between your collarbone and your first rib, and most anatomy courses barely mention it. It doesn't move your arm or shoulder. It's the quiet kid in the group project doing all the work that no one notices. But break your collarbone, one of the most commonly broken bones in the body, and this ignored little muscle turns out to be the only thing standing between that jagged bone fragment and the major blood vessels sitting directly underneath it. It's a biological crumple zone built into a spot most people didn't know needed protecting. On a normal day, its job is quieter. Every time you lift your arm or move your shoulder, the collarbone shifts slightly and the subclavius keeps it stable and on track. It's the kind of muscle that never gets noticed, because everything only goes wrong when it isn't doing its job properly. The one time it causes problems is when it grows in an unusual shape, pressing directly on the nerves running down your arm and triggering the kind of chronic pain and numbness that takes months to diagnose correctly. A muscle so forgettable it doesn't make the highlight reel, quietly preventing disasters you never knew were possible. Sinuses. If you've had a sinus infection, you might remember that strange feeling of your entire face hurting, like you just ran headfirst into a wall. For others, the feeling is often described as wet sand in your head. In reality, those hollow caves called sinuses constantly produce a gas that kills bacteria. Your sinuses pump out something called nitric oxide, a natural antimicrobial gas that gets swept into your airway every time you breathe in through your nose. It slows down bacteria and viruses before they can get any further into your body. Your face is running a fumigation operation around the clock and never once sent you a notification about it. The whole nasal and sinus system also works like a climate control unit for your lungs, warming cold air, adding moisture to dry air, filtering out dust and particles before anything reaches your airways. The sinuses feed directly into that system, and when the drainage gets blocked, the whole thing backs up fast. That's where the wet sand feeling comes from. People have also long claimed sinuses make your skull lighter and give your voice its resonance. It's a plausible hypothesis, but still debated. The random face holes everyone complains about turn out to be some of the busiest real estate in your entire face. Plantaris muscle. The plantaris is a small muscle running down the back of your leg that contributes so little to movement that roughly 1 in 10 people don't have one at all, and those people never notice. By every visible measure, it is doing essentially nothing, which is exactly why surgeons love it. When tendons elsewhere in the body get damaged badly enough to need reconstruction, in the hand, the wrist, the foot, surgeons need donor material that's strong, flexible, and won't be missed. The plantaris tendon, long and thin, and quietly sitting there doing almost nothing, is a perfect match. Your body grew a spare tendon and filed it under backup, and most people go their entire lives without knowing it's there. It may also be doing something subtler on a normal day. The muscle contains an unusually high density of specialized nerve structures that detect tension and movement, which has led researchers to propose it plays a quiet role in helping your brain track what your ankle and knee are doing in space, a kind of fine-tuned position sensor running alongside the bigger muscles doing the actual work. The one time it causes problems is when it rubs against the Achilles tendon in the wrong way, triggering a stubborn, hard-to-diagnose pain that takes months to trace back to this overlooked little muscle, a muscle so minor that losing it changes nothing until a surgeon needs exactly what it offers. Tailbone. Slip on ice, land directly on your tailbone, and suddenly this tiny stub of bone you've never thought about becomes the only thing you can think about. It hurts to sit. It hurts to stand. It hurts to exist. But that little stub is the anchor point for the entire floor of your pelvis, and without it, things get unstable fast. Several major muscles that hold your bladder, bowel, and organs in place attach directly onto the tailbone. It's the last tent peg in a support system that keeps everything from sagging inward. Pull it out, and the whole tent loses tension. That's not a leftover from evolution. That's load-bearing architecture. It also shares the job of holding you up when you sit, spreading your weight alongside your sitting bones, which is exactly why bruising one turns every office chair into the Iron Throne for weeks. The bone even varies surprisingly between people, with different curves and sometimes different numbers of fused segments, which is part of why the same injury feels devastating to one person and minor to another. Even though it's just a 3-inch bone, it's the MVP holding your lower body together without a single day off. Darwin's point. Reach up and run your finger along the outer edge of your ear. If you feel a small, subtle bump near the top, that's Darwin's point. It's a little cartilage nub that seems to serve no purpose. That tiny bump is a piece of visible human evolutionary history, and it turns out your ear shape, bump included, is as unique to you as your fingerprint. No two ears are shaped exactly alike, and researchers studying forensic identification are increasingly interested in ear morphology as a reliable way to identify individuals, from security footage, crime scenes, and photographs. Darwin's point is one of the more distinctive variables in that map, precisely because its presence, size, and shape vary so much between people. It also carries information about human population history. Its prevalence varies across different groups, which makes it a useful marker for anthropologists studying how human traits have shifted and spread across time and geography. So while it's a small cartilage bump with no job title, Darwin's point is quietly making your ear one of a kind. If you like this video and want to learn more about unique hidden advantages, check out these other videos.